Good afternoon. I wanted to just expand a little bit on some of the things that the governor just announced. It has been my privilege to serve in public office in both the legislature and the executive branch. And so I've had a chance to go through difficult budget decisions over time. We went through them after 9/11. We went through them after the Great Recession. And now we're in the midst of the global pandemic that coronavirus has created, and there are both health and economic consequences as well as budgetary consequences. In all of those times, I can never recall a period where we went in basically a 2-month period to having a $1 billion swing, from having more revenue than we had estimated to having far less revenue. $200 million overage to a $779 million shortfall. That is the most dramatic swing I can ever recall. We don't know how long it's going to last. The economic consequences, the budgetary consequences could be shorter, could be longer, but it's prudent, as the governor mentioned, to plan for the long haul. In the end, this is about providing as much stability to the people out there, because that's where most state government goes, where state government money goes, is outside of state government. It goes to schools, it goes to healthcare providers, and I'm going to touch on that in just a minute, but we have to plan for that future. And Eric, if you could put up the blue slide or the pie chart there. This, I think, really gets at the heart of it. If you look at the three pieces of the pie, the gray is essentially debt service. That's what we pay out of the state budget for debt service. The green is what you would call administration. That's all of the elected officials and the courts and everything that it takes, legal, administrative, all of that to administer state government. It's not a huge part of the pie. The blue is everything else. That's the money that goes out the door for Medicaid providers, it goes out for K through 12, goes out for higher education, and for local government. And that's the challenge that we have. That's why when you see money that gets cut from the things that we dread cutting them from, schools, Medicaid providers, and the like, it's because the state has to balance its budget, and that's where all the money is. The green piece of the pie and the blue piece of the pie are getting its cuts. Everything else is debt service. And I just wanted to put that in perspective for folks so that they really understand how the state budget works. We balance the budget. Most of the money we have goes out the door to serve other people. And that's the nature of how state government operates. I do want to say this as well, that, and I've talked about this for a while, it's a health crisis. A health crisis that, in response, creates an economic crisis with budget consequences. That's not just at state government. That's for our local government friends in this state. That's for state government. It's a federal issue. It's a global issue. It's not. This is an economic crisis that's not unique to Ohio. And while we're opening things up in Ohio, that's not going to solve the global economic consequences of what's of what we're facing. That's why it's important when you hear what we've been saying here over the last few weeks about learning to live with coronavirus in our lives, protecting lives and livelihoods, and doing two things at once. Those are kind of the themes that you've heard often, because we know that we have to get the economy moving so that people can pay their bills, and so that the private economy, which funds public services, can be as robust as possible. They all fit together. And we have to design a policy. The governor is in charge of designing a policy that meets all of those needs, that tries to put people back to work, that gets the private economy going so that we can fund that social safety net that education and children depend on, that healthcare and people who need healthcare services depend on. It is the social safety net that is critical to our lives. And so that's why all of this has to come together at once, why it's so difficult to piece these pieces together in a way that strikes that balance. And I really believe that we are in a great position because of the early decisions, because of the early warning that Dr. Acton provided, because of the quick action that the governor undertook, because of the partnerships that we have with business that is talking about how we can safely return to work, protecting employees and customers, beginning to get the Ohio economy moving so that we can serve everybody that depends on both work and public services. So I really believe that Ohio is poised to do this as well as any state in the country. And you're getting from us at these podiums every day a bit more of what those plans look like. It is moving forward, and it will all depend on how we pull together to make sure that we're doing the things in our private lives to keep us healthy, to not spread the coronavirus, so that we can get the economy back working, get people back working, and help to provide for the services that everybody needs.